Welcome to Political Pandemonium 2020, a series of 4 workshops presented by the Technology and Social Change Research Project at the Shorenstein Center on Media, Politics, and Public Policy of the Harvard Kennedy School. Hosted by Research Director Dr. Joan Donovan, these sessions explore the harmful effects of media manipulation on our society. Our second workshop, entitled The Negative Consequences of Public Health Misinformation, Media Manipulation During the Pandemic, features a conversation with Dr. Seema Yasmin, Director of Research and Education at the Stanford Health Communication Initiative, Dr. René, Najera, editor of the History of Vaccines Project, and Brandy Zadrozny, reporter at NBC News. We hope you enjoy the video.
Welcome, everyone. Happy to have you here. We're going to have a really interesting discussion, I'm sure, because I'm sure everybody's experiencing some Zoom fatigue at this stage of the game, and it's sort of the end of the short, hot summer. It's remarkably fast moving June, July compared to the slow roll of March and April. So yeah, I'm just sort of bracing for September. So I hope everybody is feeling well and is excited for this Political Pandemonium workshop. I am Joan Donovan. I work as the research director at the Harvard Kennedy Shorenstein Center. I am presently working out of my house, so this is where I live. Welcome to my house. Dwight is going to be running tech assistance on this, and he's a researcher and student at the Harvard Kennedy School, working with us on the Technology and Social Change Research Project. And today we're going to have a really interesting and focused discussion on the negative impacts, as if there could be positive impacts, I guess, of medical misinformation. And I'm going to ask that people use the chat function if you want to interact with this, and there will be a space for Q&A, and then to mute yourselves when you're not speaking. We are going to run the first 45 minutes as a discussion between me and our esteemed guests. I was really happy to get my first choices for folks who are engaged in this work deeply and personally and on a day-by-day basis. And then we will field questions from the chat, as well as at the 45-minute mark, because we have asked so much of our professionals who have joined us, they are going to be able to, if they want to, roll out of the conversation and go back to their day jobs. And then we are going to stay on until 3:30 discussing the media manipulation life cycle and medical misinformation, and thinking through some of the more complex questions about how do you build trust in what feels like a very polarized and distrustful media ecosystem? Where are the points of resonance that we need to find? Where are the places we need to go with information so that people are able to understand what the true risks are of this deadly pandemic? We've called this workshop Political Pandemonium, where we're really thinking through the moment right now of 2020, where we want to understand protests, we want to understand the pandemic, and we also want to understand politics, and especially as the election in the US is looming. And I hope everybody's had time to register to vote and to find out how to do that in your local area. So I'm going to introduce our panelists for today. We have Seema Yasmin, who's an Emmy award-winning journalist, a public health doctor, an epidemiologist, and an author. And according to my room rater score, is doing a really good job of holding the Zoom down, and is just sitting out there in the sun, which I'm very jealous of. She was the finalist for the Pulitzer Prize for breaking news reporting with her team at the Dallas Morning News, and she served as an officer in the Epidemic Intelligence Service at the US CDC. In 2017, she was selected as a Knight Journalism Fellow at Stanford, where she studied the spread of misinformation during epidemics and the role of journalists in countering false health news. Not to be outdone, Brandy Zadrozny is an award-winning investigative journalist and featured reporter at NBC News, where she covers misinformation, extremism, and the internet. Brandy is someone who I trust deeply with our research and often will share things just to ask, are you seeing this too? And what are the implications of that? This year alone, she's written definitive pieces on the stories of the QAnon conspiracy, the Trump propaganda outlook, the Epoch Times, and the profiteers behind the rising anti-vaccination movement and coronavirus misinformation online. Previously, Brandy was at the Daily Beast, where she covered politics and the internet as a senior reporter. And a little known fact about Brandy is she has an MLIS and is a librarian. Which brings us to René Najera, who's a doctor of public health and a senior epidemiologist at the Fairfax County Health Department in Fairfax, Virginia. He's also the editor of the History of Vaccines Project for the College of Physicians in Philadelphia. And I welcome you to all follow the History of Vaccines Project Twitter account, which does an amazing job of getting out timely and relevant information. And they track the numerous in the long history of vaccines. He earned his PhD, Dr. PH in epidemiology from the Johns Hopkins Bloomberg School of Public Health, and also has a master's of public health from George Washington University. So I think I might be outmatched here, which is to say, I don't know if I'm the right person to describe what is going on right now. So I would love to ask our panelists, just as a initial round of introductions, to talk about just in the past few months, what have you been seeing? What have you been paying attention to? How has medical misinformation become a priority in your life? And we'll start there. I'm going to start with René.
Hi, thank you for having me. So, can you hear me?
Yes.
All right, great. So, medical misinformation, it's been very interesting to watch what's been going on. I usually deal with the anti-vaccine crowd because they show up at the History of Vaccines website, or they say something that catches my attention. But now they seem to be conflagrating into this group that both believes that Big Pharma is out to hurt people with vaccines, but at the same time, we need to listen to Big Pharma and hydroxychloroquine. And it's just this amazing effect of misinformation that in both pro-pharma and anti-pharma, and they're coming together and they're doing this. And so then you have the really out there theories of, they want to put a chip in us for vaccines to, we need to look at what Russia has done with their vaccine, and we need to bring that vaccine over right away because it's going to save lives. It's just amazing what they're doing, and I'm both amazed and confused by the level of contradictions that they wrap themselves in when they're doing all these mostly social media presentations on everything related to COVID.
That is amazing, and I'm glad that you marked that, because that seems to highlight one of the things we're going to get into a little bit, which is the effects of our political environment on what people perceive as risk. Seema, do you want to talk?
Sure. So I've been studying medical misinformation and disinformation for a while now. One of the things that I am noticing in the current crisis is a reaffirmation of something we've been saying for years. which is one, that these groups, these anti-science groups, for example, anti-vaccine groups, are not a monolith. They are complex groups that are nuanced, that have these different belief systems within those groups. They are not monolithic. But also that there's this real politicization, of course, of these messages that's become a lot more apparent now. But one of the things that I am finding interesting in studying and tracking and talking about is that, for example, it's not that some people are saying vaccines contain mercury or vaccines are a ploy by the government to microchip us. It's not necessarily always about the veracity of the scientific evidence regarding the intervention, the medicine, the vaccine. The messages that we are tracking now that are anti-vaccine frame vaccines as oppositional to the American way of life. They talk about vaccines as being anti-American freedom, and also framing masks in that same way. I think this is complicated. I think it's never been simple though. But one of my frustrations is that as we start finally to get more buy-in from some public health institutions that, oh, wow, the spread of health misinformation and disinformation really is a public health threat, as you've been saying for years. It's also ensuring that they are not addressing it or countering these false narratives in overly simplistic ways, which is the majority of what's happening.
That is a bleak proposition. Brandy, I know that you have been deep in the world of medical misinformation, especially QAnon. And so I say that with the caveat to our listeners today that, that you might say some things that are completely outlandish and these are not your own views.
Or are they? No, yeah, I think, you know, I think that the idea that's just been said more eloquently than I will, that for a while, you know, my colleague Ben and I work very closely together and we work on extremism in the internet. And so for a long time, I was like, you know what, you take political extremism, you take, you know, white supremacy and the far right and all of that, and I'll take health misinformation. So I'll join the cancer groups, I'll join the anti-vax groups, I'll do that. And then suddenly with COVID, all of those groups seem to bleed into each other. And we were hearing a similar message in sort of all of them, which was, again, freedom, the ability for one to make their own choices, not a distrust in medicine and government institutions. And then you had someone like Dr. Fauci, who's a member of both, and so he is a really good boogeyman there. And so you have, you know, similar devils of both groups, of several groups, and it's just like, I call it the boss level, because the cooperation is really the interesting thing. It started with the reopen protests, and it's, you know, bled into the pandemic stuff, and now we're seeing it with the anti-masks and the pandemic Karens, and we're seeing it play out there. And then now we're seeing it, of course, in the Black Lives Matter protests too. So it seems to affect this medical misinformation, no longer just the things that I used to research, which is like, you know, cancer scams and the anti-vax, you know, profiteers, but now it's just bled into every single area of extremism online. So it's hard to keep up with.
No, yeah, we often on our team, I sometimes will call this this is the King Koopa, you know, referencing, you know, Super Mario Brothers. But there is this moment where, you know, the pandemic forces us all into what feels like a very 90s style internet situation. We're all kind of yoked to our desks, sitting in front of cameras, trying to discern truth from facts, and we're all using the same tools. And then as a result, we've all become susceptible to the same kinds of misinformation. And it's really difficult when you need answers to not be able to reach out, to not feel as if you're going to be taken seriously. And in the early days of this pandemic, I want to sort of rewind for a little bit and talk a bit about the potential capacity to think about, could this have gone differently if different actors had either been better equipped to handle misinformation, if tech platforms had taken seriously different kinds of conspiratorial groups or anti-vax groups. In your research, is there a moment that was potentially either a pivotal turning point that maybe it's not too late? Maybe maybe it's late, but maybe it's not too late to turn the tide on some of this. And I'll give an example. When I think about how conspiratorial groups have really grown with medical misinformation, I think about some of the early interventions that Reddit was able to do with QAnon, where they had decided that some of this political disinformation and the way in which this group of folks was doxing journalists, were doxing everyday individuals, were accusing people of being pedophiles, that it was creating a kind of environment or a community on their platform that they decided wasn't in line with the values of their technology and of the service that they were providing. And they took action beforehand. And so we don't, when we talk about medical misinformation, include Reddit really in those discussions. And I know, Brandy, you wrote a little bit about stuff like this in the past. So I'd love to hear from you first about what you think were some of the potentials that were maybe lost in the early aspects of the pandemic.
Yeah, I think that's a really interesting point, because when we don't talk about Reddit as much as we do other platforms. One, because of its size, but also because political people politicians don't really use Reddit, right? Journalists use Reddit to find stories, but they don't really, besides like specific internet websites, they don't really use it as a constant, like they don't consider it part of communication the way that we do Twitter and Facebook. And so it doesn't get the same kind of play. But that was a really pivotal moment, because it showed that, one, a platform could say, you know what, this is our house and we don't like that information. We don't like this sort of content. It's bad for us. It's bad for you. It's bad for society. We're going to quit it. And they've done the same since then with the Donald subreddits and everything like that. They showed us the power that an internet platform could wield if it chose to. And then I think, ever since then, we've just sort of gone downhill, because they moved from Reddit to YouTube and Facebook and then Twitter. And then it just like grew exponentially, mostly because of Facebook's pivot to community and their focus on groups and their recommendation of the wildest, most insane groups to the people who needed to see them the least. And so I think when you talk about turning points, something that I think of, or that I've been thinking of, is the second version of the Pandemic video, when it was right after Twitter had decided we're going to seriously squash QAnon on the platform. Facebook just the previous week had said the same. They wiped out a couple thousand groups and pages and seriously strangled the hold of other ones. They said they would stop recommending them. They're working on that. But so they finally decided to do something. And then they got a chance to show if they could do it, because they had a preview. They had someone that said, we're about to show you misinformation. You've already determined it's misinformation. We've already determined exactly how, but we have round two. It's coming for you on this time and this date. And they really easily stopped it from growing and spreading virally on the platform by stopping the URL. And so they showed they could do it. And for me, that's very hopeful, but it's also maddening, because if people like you and I, Joan, and your team and a couple of researchers and some journalists can spend all our time in these groups and in these places on the internet and like point it out and say, this is the problem, here it is, here's what you need to do. Why does it take them up to now, when the crisis is like roiling already? Like it feels too late for me, and I hope that it's not, but it's just like they've proven they can do something about it. Reddit proved years ago that when you do something about it, it can work. And here we are in the middle of this craziness.
Mm-hmm. Yeah, Seema, I want to go to you and ask a bit too about this, the turning points, especially in journalism and health communication, and the stuff that you've been looking at about the distribution of misinformation and true information. Where do you see there were key turning points that maybe were missed opportunities or opportunities found?
So I also want to respond to just the last point of discussion as well, because I think we have to be careful in framing it as what was the pivotal point within this current crisis, when I think the pivotal point was many years ago. We in public health for sure dropped the ball in terms of addressing health misinformation and disinformation, relegating it to, not such a big public health concern. I don't think it was until 2018, in fact, that the World Health Organization listed anti-vaccine movements as one of the top 10 public health threats in the world, which is absurd to me, given we tout vaccines as one of the pivotal public health interventions for the last century. And the evidence has been there about how much harm these movements can do. I also think, Brandy asked that question about like, why don't the platforms do more? I think it's because of money, essentially, because when you look at Facebook's algorithm, it rewards engagement with crappy information. It rewards engagement with news that is sensational and novel, which are exactly the triggers and the red flags that we use when we teach people how to assess information as in terms of the likelihood of it being accurate or inaccurate. We saw that MIT study from 2 years ago, which showed false news travels farther and faster than the truth. But really, when you dig into it, is why is that? It's often because the false news is novel, because it's not true, and it's very emotionally triggering. And so I just want to raise that, because I think with that Avaz report that came out, I think last Wednesday or Thursday, we got even more data about the magnitude of health misinformation and disinformation on Facebook. We saw that there were like that the anti-vax messages about Gates backing a polio vaccine years ago that caused mass paralysis in India, that got viewed 8.4 million times. And overall in the past year, health misinformation and disinformation on Facebook was viewed 8.3 billion times. Avaz did this like smaller analysis where they just looked at a few hundred posts, I think, that they had categorized as being inaccurate health information. And Facebook keeps saying, well, we apply warning labels to this stuff. But in their analysis, only 16% of that health misinformation or disinformation was appropriately tagged by Facebook. So, I mean, that's what we're up against. And as Brandy said, there are platforms that have shown us how it can be done. Even when you look at how TikTok has removed content that is spreading false news, it's such a greater magnitude at which they have removed content compared to even YouTube, for example. So there's no perfect example, but there are some better examples of social media platforms downgrading or just outright removing the crap that is really harmful to public health. But in terms of like that pivotal point, I don't think about it as like, when was that during this crisis? I think about when was that in the past decade or two that we did not address what was becoming a bigger and bigger public health problem.
One interesting point, one of my research assistants, Jen Nielsen's been looking at how the medical field viewed the adoption of the internet. And we found this quote from the late 90s where I think it was in JAMA or one of the large medical journals, where a doctor was just sort of ranting that the internet is not going to be a place for knowledge. It's going to be a disaster for medicine because people are going to go online and self-diagnose and try to seek out different kinds of cures. But on the flip side of that, I look at research by folks like Nicholas Rose and Carlos Novas in the early 2000s, where they were talking about how certain diseases may never even have had a chance at a cure because patients hadn't found each other and hadn't talked to each other. Things like restless leg syndrome may never have existed without the internet because there was such a lack of a community to push that. So there is this this issue that we have to address around that for sure.
And to be honest, Joan, we doctors, we still use fax machines. So I wouldn't necessarily get tech advice or analysis from us physicians. But I think that bleak outlook kind of back in the 90s that you're talking about shows exactly how much we missed that opportunity, because we were just, I think, in many cases, viewing it as this is going to be a nightmare. Everyone's going to be Googling their headache and thinking they have a brain tumor, as opposed to how might we deploy this fantastic tool in efforts to improve public health.
That's a really great point. René, I want to go to you and get some of your input on from the ground level, what you've been seeing around this over the past couple of months or in previous rollouts of vaccines, is the sort of fear mongering, especially around a vaccine that potentially both tattoos you while giving you a microchip, while sending a drone to your house. What then is the expectation of ordinary folks, and how does that change the work that you do?
So a couple of things. I've been off from work this week just because I needed a break from the craziness, and I decided to fix my bike. And I took it to a bike shop, and there's a point to the story. And I took it to a bike shop, and the guy couldn't fix it anytime soon because he was just overwhelmed with the number of bikes that he had to fix because everybody during the pandemic decided that we're all going to become cyclists. And I said, okay, well then I'll do it myself. I think I can because my dad is a mechanic and a car mechanic, and he taught me how to use tools. So I started Googling how to fix my bike. And I think that leads us into the issue of why do people do this, right? Why do people go seeking healthcare advice online and then can't differentiate between the good and the bad advice? It's because they don't know. And so I went online, and with whatever limited knowledge I had of how mechanical things work, I was able to figure out some things about my bike, but I'm probably going to have to take it to the shop anyways because I'm going to get something wrong. And so we have this issue of access to an enormous amount of knowledge and a lot of misinformation in that knowledge, and very, very, very limited access to healthcare professionals, to experts. And some of the work that I used to do, especially I used to work at a state health department, we were not allowed to answer any questions that came in from the public. It had to go through an entire line of people to the public information officer, and then they would have to check with the office of the secretary to see if we could answer a question, a very simple question about a vaccine. And in that time, I assure you, that person probably went online and looked for the answer themselves. And so there's this disconnect of how to communicate us, the public health professionals, the healthcare providers, the experts, to the people. And if we don't do it, and we haven't been doing it well, and so they've been looking for their own answers. And so now we're left in the situation where we're gonna have these vaccines coming. The mRNA vaccines is a very complicated feed-in technology. It's a leap forward in vaccine technology, something we haven't seen before. And not a lot of people are explaining it. And so then you get into the misinformation because the people who are trying to explain it are saying, oh yeah, they're gonna shoot you up with RNA, which sounds like DNA, and then they're gonna program your cells to create antibodies. Well, are you putting things into my DNA to tell my cell to do something? And it's a very simplistic way of explaining how that vaccine works, but it's being done by non-experts because somewhere along the way the expert died because the expert wasn't available for a simple set of questions. And now we're left with a lot of people who don't know any better doing this. And unfortunately, there is a minority within that big group of people who do know better, who have medical degrees and who have the scientific background. But because they're showmen and they're making a lot of money out of what they say, they're willing to stick to their guns and go with misinformation and things like that. And that is, at the public health level, it's killing us. It's literally killing us now with COVID-19, where people are getting the information from other sources that are not reliable, and they're doing some very, very stupid things. Stupid from the point of view of somebody who knows better, but from their point of view, they're doing the best they can with the knowledge that they've gotten.
Mm-hmm. Yeah, I do think you're right, though, that we're gonna, yes, please, Seema.
I was just going to say that, medical training and scientific training does not make you a scientific or medical communicator, right? That's a specific skill set that unfortunately we have really undermined. But if you look at the decades of scholarship on science communication, what you see is that we repeatedly employ methods that are shown to have massive deficiencies in how they convey information. So for example, there's the knowledge deficit model, which is what we actually do, where we say, oh, there's a knowledge gap here. Let me give you some information. I have really rigorous evidence. But like I said, we have decades of scholarship that providing more information doesn't always work, and actually on its own is not enough. You add to that the fact that you are having these discussions during a very polarizing time. and that these debates themselves are very polarized. And then we have actually loads of scholarship showing that pouring facts onto a polarized discussion is like pouring kerosene onto a fire. And yet, and yet, in public health and medicine, we are armed with the facts. We have information. Vaccines are safe, thymerasol's fine. When we have evidence that we keep disregarding, that alone isn't enough, that there are much better ways to communicate, and yet we still refer to science communication as a soft skill, as something that's not as rigorously studied, for example, as, I don't know, biostats or some of the study designs that we do. And I say this as someone who trained in medicine and epidemiology with all the respect in the world for that basic science, but it's not sufficient in bridging those knowledge gaps. And that's a big point of frustration for me. And I've written op-eds about this, most recently one for CNN, talking about the vaccine and Operation Warp Speed, which, I mean, just the name of that tells you how bad we are at science communication. That is a terrible, terrifying name for an intervention that we need to be safe and efficacious, but we're calling it Operation Warp Speed, which screams of cutting corners and cutting safety.
No, I completely agree with you with the metaphor on that. And Jen, my research assistant's also looking into that. Just the rhetoric alone of warp speed, the swiftness over safety model, which is playing into this, is definitely at odds with how we should be communicating. And I agree, a lot with this notion of how you explain what a vaccine does, like the mechanistic way, the metaphors that we use, like it programs your cells, right? That kind of language can be really scary for people if they don't understand exactly what's happening. And we got into some of that in the past where, the idea of a living vaccine, right? That you're getting a living virus. And as a result, people think, oh, well, then I'm going to be infected. And so they don't want to take, some of the flu vaccines. And the rollout of the treatments, though, has been hyper politicized, right? And so thinking back to when the notion that an old medicine who's been here a long time, well-known side effects with hydroxychloroquine, that might be the magic bullet that saves the day, that the solution was here all along. I wrote about that as soon as I saw it pop up for Nature, because I was really concerned that we're going to get into this model where it's not just that we lack experts that are explaining things in ways where health communicators need to be able to communicate to the public swiftly, but also that it's politically advantageous to have people think that a treatment is on the way, or because it does put people at ease. It makes people feel like that it's not as severe as it could have been, that if I do contract it, there will be some way of me of getting better from this. And in a way, it really downplayed a lot of the risks of the reopening, about the kind of measures people needed to take in order to reopen. And so I want to think about that moment with hydroxychloroquine and try to future cast what you all think might end up happening given the current media and partisan environments with the rollout of a vaccine. Are there things that we should be prepping for now as academics, as misinformation researchers, that might help us? Obviously we're not going to fix everything, but are there things that we can do to alleviate some of the traumas that we've seen happen in the past? Seema, I'm going to go to you first.
Sure, and I would start off by saying that we have numerous case studies from vaccine history in terms of how we medical professionals and public health practitioners have screwed up communication. I wrote about some of those in that CNN op-ed. So we've seen how badly we can do it, and then we've seen the ramifications of that with low vaccine uptake for some particular vaccines. I think some of the lessons will have to be that we're going to be doing damage control because there hasn't been transparency and effective communication during the development of COVID vaccines. So we're going to be doing a lot of damage control, damage limitation in terms of trying to do things to build trust with people. I think that's exceptionally difficult. It's like the wrong way of doing things. But the other thing, again, coming back to this point that communities are not monoliths, we're going to have specific messages for specific communities. So René mentioned earlier, like the gaps you have between some communities and science, and also the fact that we take a long time to do science. It's a rigorous process. In a nutshell, one of the ways that we saw that pan out in Minnesota was in recent years, Minnesota had its biggest epidemic of measles in 3 decades, mostly affecting the Somali American community. And when you look like 10 or 15 years ago to how that started, it was because Somali parents in Minneapolis mostly were really concerned about elevated rates of developmental delay like autism among their kids. So they did take this concern to the public health department, and they did what we do, which is, oh, we're going to take this seriously, we're going to study it. In the meantime, while they are studying it, you have Andrew Wakefield's group, you have these other anti-vaccine, anti-government groups fly in to Minneapolis to do these town halls with the Somali community where it's closed. So people, journalists, public health practitioners can't get in, and they had armed guards outside. And they were saying, you're right, autism rates really are higher among Somali kids, and it's because of the MMR vaccine. And so over the course of about 10 years, MMR uptake among Somali people in that community went from like the 90% kind of point to lower than 50%. And then you have this massive outbreak. But I make this point because yes, we are really slow, and that's what sometimes it requires to do rigorous science. But in the meantime, there are people exploiting that slowness and our crappiness at communicating. And also what we often do in public health is what the WHO will proudly announce, which is, oh, there's a really big measles outbreak in Romania. It's okay, we are disseminating pamphlets. And you're like, yeah, you know, bullet points aren't going to counter these sophisticated false narratives. And also the message you're going to have for some groups that are going to be different for others, because as I said, communities are not monoliths. If you're looking at Black Americans, for example, there are some that are not vaccinating because of very recent unethical experimentation on Black people in this country. So the message in terms of building trust about potential COVID-19 vaccines or treatments for that group of people might be quite different to, I don't know, people in the Bay Area. You know what, you get the point. I'm saying it's going to have to be nuanced, and it's going to have to be a lot of damage control.
René, from your point of view,
Oh yeah,
you know,
yeah, the damage control for sure, because I'm already foreseeing the magnification of a single or a handful of adverse reactions to any vaccine by both the anti-science and the anti-vaccine and other groups, just blowing it out of proportion, and then that will set back the whole vaccine effort for COVID-19. I'm seeing if a vaccine comes out and it is safe and effective, or relatively safe and relatively effective, before the election, certain people are going to think that it is a ploy to get the current administration reelected. If it doesn't come out, the other group is going to say, "Oh, you're withholding it for the election because you don't want the current administration reelected." And so in my head, as a public health practitioner, I'm already thinking of how am I going to answer those questions when they come up. And you know, although I'm not all the way up in the food chain at the health department where I work, I need to inform those people on how to best answer those questions when they come up. You know, why did this person have an adverse event? Why are those adverse events happening? Why is the vaccine ready? Why is it not ready? You know, and do it in a way that is quick, that is understandable, that you know can fill in the requirements of Twitter and Facebook. And we need to catch up in that respect, because if I stand up on a lectern and start to give a lecture about vaccine epidemiology, I'm going to lose a lot of people. And you know, and so this is something that I'm already planning on. How is this going to be done? on history of vaccines. How are we going to cover, the recent developments and the developments as they happen, and put them in some sort of historical context of, like, look, back in 1959, we had lines of people, waiting in line to get the polio vaccine for their children. This has been done before, and we're going to try to do it again. And so it's just this crazy balance that we're going to have to do to be both communicators and not only effective communicators, but truthful communicators, and be slightly louder. All we have to do is be slightly louder than the anti-vaccine and the anti-science groups to be a little bit more effective.
I hear you, because I often say this, that truth needs an advocate. And Seema, the study that you were referencing earlier from Deb Roy's lab at MIT holds true, which is that when misinformation is moving around the internet, it's because it's novel, it's outrageous, it's animating reactions, it's trying to get people to say, did you see this? And this is exactly, where Brandy, your world, sits at the crux of this, which is, I take Coco's comments in the chat very seriously to say that if certain politicians endorse things or don't endorse things or are middle of the road on things, we do see that reflected in the online groups and discourses, where we're not just talking about groups of people that 15, 20 people. We're talking massive groups of people, 200,000-300,000 people that are in these groups and getting exposed to this information. So from your point of view, are there coalitions or other folks that we should be engaging, not just doctors, but is there room for activists here? Who is the advocate, or the group of advocates, or the coalition of advocates that we need to bring that trust that Seema is suggesting we definitely need into these communities that are rightfully distrustful of medical the medical establishment due to lack of care, as well as actual damage.
Yeah, I totally get that point. And I think I actually wrote a story about a woman in Minnesota who she put billboards all up everywhere, and she was going really viral in Facebook groups, and she was sort of the new poster, literally the poster child for mothers who've lost their babies due to vaccination. And so she was on the High Wire with Del Bigtree, and just a favorite daughter of Wakefield and all the rest. She was heralded in vaxxed groups. But I think part of that is not just the medium, but also the message, which typically, from what I see, when scientists and doctors and public health officials give the message of vaccines and other sort of treatments, when they give that message, it is factual, it's in scientific language. And so you guys have facts, and the bad guys have stories. And stories are they seem to be more effective. I don't know science. I understand a mother who's lost her baby, right? That's emotional. It tugs at my heartstrings. It's something that I can instantly understand. And then with that story that the anti-vaccination group is giving me, then they say, this is what happened, and I can tell you why and make sure that it doesn't happen to you. It's extremely effective. And so my hope, and what I try to do with this sort of stuff, is find stories that illustrate the broader points that the scientific and medical community is hoping to make. So whether that's telling the story of a mother who lost her child due to a vaccine preventable disease but was too young to get it, right? And so she tells her story and then is swarmed by anti-vaccination profiteers, and tell it in that way, where we have a victim where everyone can say, I understand the harm that's done here on an emotional level, and then sort of inserting all of the science and history along the way as sort of a, broccoli with your dinner. So that's what I try to do. And if numbers are any consequence in terms of readership, they do very, very well. And they get shared a lot on social media as a way to counter sort of the rising stars in whatever movement, the anti-vaccination movement or the QAnon movement, you'll get people that say, actually, there's a record of this person, in a way that like a doctor's not going to go after a grieving mother. And I don't want to go after a grieving mother too, but I can shine a light on it and say, things aren't as they seem. And I have the ability to do that when maybe doctors or people with lots of, initials after their names can't do. So I think that there's room for an advocacy as part of journalism. And I think that journalism is in a way advocacy anyway. So I think more journalists on this beat willing to tell stories like that. And there are many of us, and we rely very heavily on people like you and Coco, who I saw in the comments, to do this work. So that's what I do. I don't know if it's right, but.
No, I think I absolutely agree with you. And there's a lot of social science analysis on, narrative analysis, narrative theory, which is that, yeah, people want things to resonate, and that facts can feel dry, they can feel boring, they can feel technical. Whereas if you can tell a compelling story and also get people to understand more about the why of science, that can also be really powerful, especially in this moment as we're trying to understand, in a world where everything feels so fast, right? Fast food, fast broadband, you no longer even have to go to the store to get a record to play it at home, right? You just queue up YouTube, you can hear everything, you can see everything. So the notion that we would have to wait for science to make their discoveries, and to build and to build knowledge, it feels really it feels really like the time is not what's actually, like the time feels like what's at stake in some ways. And I do hear you around exploiting that misinformers, disinformers are really exploiting the slowness, right? The grifters, the scammers, the people, they step into the void of where people really want to understand a very specific nuance, and they kind of hook into that nuance and spread all kinds of other misinformation when people are searching for answers. I want to thank the panelists for joining us and give you an opportunity to get off the line here. And I'm sure everybody who's been a party to this has found it informative. I know I really have. And so, but feel free to stay on if you want. We're going to jam on some questions about COVID and hear from people in the workshop about what they think is some of the big misconceptions about COVID that we should be trying to address, and to get a better sense of what others are seeing and wanting to do about it. So you're definitely welcome to stay, but if not, I really appreciate you being here, being part of this discussion.
Can I add one thing real quick? So
Yes.
I'm on deadline, so I do have to leave, unfortunately, although I'd love to stay for your presentation. Just in addition to what Brandy was saying, like, yes, those stories that are false are so compelling because they are stories and we love a good story, but there's also so much false certainty in them. Look, this mother's child got vaccinated and then the child died. And when it comes to us epidemiologists, here are the 16 limitations of my study, right? We're always talking about, right, the fact that you can't say things are causal, or very rarely that you can. And so that's another thing that's really, really challenging.
Definitely. No, I hear you. And I saw in the chat people were eager to talk about preprints and to get into some of the nitty gritty of that. And I have a podcast I can share from Big If True, where we did tackle those kinds of information. And yeah, so thank you all so much. And I look forward to seeing you on the internet, of course.